Dental practices in India and abroad are facing the tremors of this COVID-19 crisis of a severe magnitude. Let us pave a new way to navigate this uncertain course. I call upon stalwarts, trendsetters, and the pathfinders from all dental specialities for piloting a new care initiative in order to make dentistry in India emerge superior to its existing self.
We are facing the most challenging time of our generation has ever faced. We have to learn to live with COVID-19. We have to reset and restart our professional journey again. Remember, you have to prepare yourself, you have to prevent the cross-contamination, and you have to follow the protocols to safeguard the humanity.
Do teleconsultation to avoid physical consultation. Practice need-based dentistry and then practice want-based dentistry.
Please redesign your clinic, make it clutter-free so that you allow maximum ventilation.
Prep for consent, prescriptions, test reports, post-operative instructions, all in electronic form and no paper. Turn all your payments digital. No cash transaction, please.
A must-have for every office desk is a contactless infrared thermometer and a pulse oximeter.
On arrival of your patient, please make sure you provide proper sanitization. You must give your patient mask to wear, the head cap, shoe cover and gloves.
Don't forget to wipe off all the flat surfaces and tabletops to keep them virus free.
Invest in at least 2 of the following aerosol agents like fogger, HEPA air purifier, UVGI or negative ion generator.
1% sodium hypochlorite, you can use it to disinfect the instruments after procedures, after doing a treatment. 0.1% sodium hypochlorite, you can use it to disinfect the surfaces and flooring. And 0.01% sodium hypochlorite, you can use it to disinfect your water pipes, tubes and all the drainage pipes.
Patients should be provided with a pre-procedural mouth rinse of 1% hydrogen peroxide or 0.2% povidone iodine and should be scrubbed extraorally with an antiseptic wipe.
A big no to intraoral x-rays in these COVID times. Resort to OPG or CBCT if absolutely required.
Make it a rule of thumb to practice four-ended dentistry, quadrant dentistry, always using rubber dam.
It is best to categorize your treatment plan at 3 levels. At level 1, you do a screening and a consultation. At level 2, we do non-aerosol procedures. And level 3 is reserved for aerosol-based procedures.
Seems like a war zone, doesn't it? So level 1, we're talking about eye cover, the face shield, all the PPE that you can wear. It's about 60 to 70-75 GSM should be adequate. If you're getting into a level 2, then level 1 plus the PPE should be slightly of a higher GSM, go on to about 100. And then if you're going to level 3 procedures, then level 2 observations of guidelines plus a coverall which is going to around almost 120 GSM.
Make or convert additional preparatory area for donning and doffing of PPE.
The most valuable clinical tip that I can give to you to be able to do aerosol generating procedures safely in your clinical operatories is to focus on the ventilation inside your dental operatories. In order to do this, you need to achieve 6 air changes per hour. You can do this in 2 ways. One, which I'm going to do, is to have HEPA medical grade air filters inside your operatory, which can filter the air and you can use the air conditioners while you work. If you feel that you cannot afford a HEPA air filter, the simple and economical way of doing this is to buy a pedestal fan and an exhaust fan. Keep the pedestal fan behind you when you work, and the exhaust fan should be installed behind the patient. This way, the airflow will be from towards you, towards the patient, and towards the exterior.
Vacate the operatory while disinfecting with HEPA, ultraviolet germicidal irradiation, fogger or a fumigator, and provide sufficient time as per manufacturer's instructions.
Post-treatment chairside disinfection protocol. Clean and disinfect the dental chair, including the spittoon, with a 1% hypochlorite solution. Run this solution for at least 30 seconds to 1 minute through both your low and high vac suctions. And lastly, mop the area for 3 feet extending around the dental chair with the same 1% NaOCl solution.
Work longer hours with few patients and long inter-patient time. Prepare your sets well.
Now that you've got the shared wisdom, please try and incorporate these guidelines in your practice as maximum as possible. Hard times may have let us down, but will not last forever. When we face difficult times, know that challenges are not sent to destroy us, they are sent to promote, increase and strengthen us.